Next, we will have Professor Rajkumar, the senior vascular surgeon, as I said in the morning, who was responsible for taking this product from this phase 1 clinical trial up to phase 4, which is now available for all of us in India. The Indian patients, we are able to avoid amputation because of work from these stalwarts. Welcome you, sir.
Good afternoon. At the outset, I would like to thank Dr. Ravi and his team for bringing this stem cell awareness on the uses of stem cell, which is going to be the future of medicine. As we know, the molecular medicine, biologicals are going to take over. Nanotherapeutics is going to take over. As in every other field, we should know more about the less and less. Stem cell is no less. It's a wonderful discovery. So today I would like to talk on stem cells in no option critical limb ischemia. The options are bypass surgery if the long segment occlusions, and in short segment occlusions and difficult, we can do angioplasty in task A, task B and task C. In patients who are not amenable for these options, the only option available is the stem cell therapy, which can be autologous or allogenic, and today I'll talk about allogenic stem cells. So peripheral vascular diseases are due to atherosclerosis and Buerger's disease in the younger people who smoke or use tobacco. And regenerative therapy is nothing but stem cell therapy, where the stem cell aims at providing collaterals and repairing the injured tissue. And what is the evidence for this? As you know, about 41 to 54 million Indians suffer from peripheral vascular disease, and 300 in a million undergo amputation in a non-diabetic, and 3,000 in a million undergo amputation in a diabetic. Camera. Stem cells, various sources are available, as it was alluded to in the morning. Stem cells can be from the limbus of the eye, from the liver, from the umbilical cord, from the uterine blood, umbilical blood, allantoic membrane, from fat, which is lipid derived stem cells, and embryonic stem cells. We are interested in adult stem cells because embryonic stem cells are prone for teratogenic tumor formation. Coming to the properties of mesenchymal stem cells, they are found in abundance in the bone marrow, and 25 ml of bone marrow cells, when incubated in a biogenerator for 3 days, can produce about 200 million cells. The advantage of allogenic stem cells are that the process is the product. In other words, the quality is maintained. There is no immunogenicity or infection in allogenic stem cells. It is available once it is ordered. It is shipped by a dry shipper, and we'll come to this next. So, coming to Buerger's, you have to stop smoking. In diabetics, you have to maintain a constant blood sugar level. In the hypertensive, you have to maintain normotensive levels and lower the lipids by statins. Coming to claudication, one of the first treatment is programmed structured walking program for claudicants, about 45 minutes to 60 minutes, and we can, with every month, the claudication distance will improve. So medical management, as you know, is antithrombotics, antirheological agents, anticoagulants, and foot care and footwear in diabetics. In critical limb ischemia, a person is prone to limb loss in 30% in a year, and in 5 years the limb loss is 50%. There is a component called subcritical limb ischemia, in critical limb ischemia, where the ABI is less than 0.5, where the toe pressure is less than 0.3, and the patient still does not have symptoms. Such patients who have a low ABI without symptoms are the patients who are called subcritical limb ischemia. 70% of these patients go in for amputation with stem cell therapy. This 70% is salvage. So stem cell not only helps in limb salvage, it helps in life salvage also. So this is the overall chart of a bit of physiology of stem cells. Stem cells produce both growth factors and inflammatory factors and cytokines. The basic property of a stem cell is to propagate both symmetrically and asymmetrically. The asymmetrical cell is the specialized cell, and the symmetric cell is the non-specialized cell or the progenitor cell. Each progenitor cell again divides into a asymmetrical or a specialized cell and a non-specialized cell. In other words, the propagation is indefinite, and every stem cell during the process of propagation will produce vasculogenesis or vascular neogenesis. Stem cell has a propensity to target ischemic areas, in areas where there is carbon dioxide toxicity, where the pH is lowered. In other words, a stem cell is plastic, and stem cell is capable of moving on a fibrin lattice network, and stem cell homes into the place of its need and propagates into the cell which is required by the body. So, in other words, the stem cell not only produces blood vessels, it also produces new cells in the injured area. A stem cell is useful to treat breast pain, claudicants. It is useful to treat patients. In other words, you can produce bypass without bypass. Stem cell produces a lot of collaterals and produces new blood vessels, and stem cells help in ulcer healing. Next. See how it is produced. Here it is aspirated from the bone marrow and cultured. So stem cells, you can see it causes decreased inflammation, immunomodulation, and it produces new blood cells. It helps in muscle regeneration. So these are the various factors which help in. These are the various factors which help in angiogenesis, which is our purpose of stem cells. The VEGF, SDF1, and angiopoietin and growth factors and interleukin 6 produced in angiogenesis, and immunomodulation helps in keeping the environment under control, and it reduces the inflammation also. There is no excessive inflammation, and ultimately these growth factors help in muscle regeneration and ulcer healing. So stem cell helps these three specific ways. It reduces the ischemia and improves the tissue perfusion and reduces inflammation. So this is what is the crux of the treatment. The outcome of this is relief of pain. Rest pain is relieved right from the 3rd day of injection. Healing of ulcer starts from the 2nd week. It's completed maximum by 6 weeks. And there's increase in ABPA, this is ankle brachial pressure index, and increase in collaterals. This is the evidence based for stem cells. This is how it is shipped, a cryo shipper. The temperature at which it is shipped is about minus 168 degrees or minus 170 degrees. It is removed from the shipper. The cassette is removed with a specialized hand glove, otherwise you will get cold burns. And it is thawed with 37 degrees centigrade at 3 to 4 minutes, and it's reconstituted. So each bag, as we said, contains about 200 million cells or 150 million cells. We have decided through trial 1, trial 2 and trial 3, the dose, ideal dose is about 2 million cells per kilogram body weight, and the total reconstituted injection will be about 50 to 60 ml. What we are giving injection, we give about 40 to 60 places I'll show you how it is given. It is given in this, we make a map of it on the calf muscle, inject about 0.5 to 1 ml at a depth of about 0.5 to 1 centimeter along the predetermined predetermined grid. So if the calf muscle is big, we can give more injections up to 60. If the calf muscle is small, we give up to 40 injections. It is done I do it under general anesthesia because I don't want the patient to suffer with pain. We can even do it under spinal anesthesia. If you do it under spinal anesthesia, be careful not to utter any inadvertent words. It will be recorded by the patient and they'll ask you questions. So ideal would be for all surgeons to do critical work or a new work, better to do it under IV sedation or under GA. And never allow the patient's attenders, anybody to record. They would say now that everybody has a phone, everybody wants to record everything. So whatever is recorded may be good, but it will be bad for the surgeon. Be careful about that. But you have to record the consent. That's good for the surgeon. In critical ischemia, I was responsible with a team from the Stempeutics, which helped us to do this research for phase 2, phase 3, and in post-marketing study. So I am totally convinced it can be used both in peripheral arterial disease and in Buerger's disease. The primary endpoints were relief of rest pain, healing of ulcers, reduction of the size of ulcer and healing, and the secondary endpoints were improvement in the ABPI, that is ankle brachial pressure index, which is a ratio. The ankle pressure of systolic pressure in the positibial artery is divided by the systolic pressure in the brachial artery. The normal ABPI is 1. Anything less than 0.5 is critical. Anything less than 0.3 is very critical. And the other thing is to measure the total walking pain-free distance and quality of life score. So we had 7 centers and more than 1 year follow-up. The post-marketing study, it was about 2 years. You can see the pain score in this chart. Initially it's at 8 and it comes to 1.7 in 6 months. We had a follow-up every 30 days, 3 months, 6 months and so on. We followed up to 2 years maximum. And you can see the ulcer size also decreased from 3.98 square centimeters to 0.66 square centimeters. We had a ulcer camera to record this. So 79% there's significant reduction in the pain and 83%, almost 84% ulcer healed. The ankle systolic pressure, even a 0.1 increase in pressure is significant. Here you can see that the ankle pressure index is increased from almost from 1, that is it increased to 7. In 7 months it increased to 94. So we didn't have any adverse events and there was no major amputation. So we are able to prove to the DCGI there's no adverse events or no systemic events. The only place where it is contraindicated is in renal failure and in congestive cardiac failure. We do not recommend stem cell therapy. Stem cell therapy is not given in pregnant women. It's not given in lactating mothers. Otherwise, you can use it everywhere. The number of patients enrolled for Buerger's was 90 patients and the results were the same. And angiogenesis we can make out by MRA, or you can check a transcutaneous oxygen level. If the oxygen level is more than 40, any ulcer is bound to heal. So it's the same thing. It's very safe. It does not have any allergic reactions. There was not even a single case of infection in my patients, and all patients are happy. And in case the patient's ulcer is big, we can even repeat it after 6 months or 1 year. That's the advantage of stem cell therapy. So 2 million is the ideal dose, and you can do in patients who have gangrene toe or up to 4 foot. We can do this stem cell therapy and then plan on amputation for a dry gangrene. So at the end of 6 months, more than 68% of ulcers healed. This is a summary. In peripheral artery disease, the rest pain decreased by 79%, ulcer healed in 83%, ankle systolic rose up to 60%, ankle brachial index in 83%, and total walking distance more than 200%. So this is a wonder drug. So initially, stem cells, they thought is a riddle in a mystery wrapped in an enigma. Now it is all very transparent and we are all evidence based, and stem cell has multitudes of applications, and it will open more vistas for the medicine in fields like transplantation, in malignancy, in infertility, in aesthetics, in cosmetics, in dermatology, in orthopedics. In every field there is stem cells. The advantage of stem cell is, as you are a baby, you have plenty of stem cells. So a baby who is injured, you can find it heals without a scar. A person who is injured in adult stage, there will be scarring. In other words, stem cell helps in excellent regrowth or regeneration in children. Stem cells in adults is less. The advantage of allogenic stem cell is the quantity, quality is consistent. Whereas in adult autologous stem cells, the yield of stem cells is less. The advantage, that is the advantage of a allogenic stem cell. This is one of the cases where the ulcer started healing. So, if you have any questions, I am here to answer.